Welcome to the Heart of Health Equity. My name is Ashlei Rodgers. I'm the host of this show. And today I have an amazing, amazing guest who's really close to my heart. Her name is Venus Ginés, who's the founder and president of Dia de la Mujer y su Familia, an amazing organization here in Texas. Go ahead and introduce yourself, Venus.
Thank you, Ashley. And it's a pleasure to be on your show, on your program. Yes, Dia de la Mujer Latina began in 1997, and it's something that we have for the last 25 years worked on developing strategies to reduce some of the issues our community, our Latino community has been harboring.
I know you guys have been around for a long time. Just tell us your story. And I think people really need to understand how much amazing work you're doing and what you've done for across the US, not just here in Texas.
Well, in 1992, I was diagnosed with breast cancer. And in 1994, my sister died of cervical cancer. And both of us had very little knowledge about what those cancers were, but we knew that the word cancer automatically meant a death sentence. Because in our community, when we heard somebody in our block or in our neighborhood or in our family that had cancer, we automatically knew they were going to die. And it's because sometimes we forget that many of people in our community don't really go for an annual exam, an annual pap smear, or an annual clinical breast exam. We don't know that that's even available to us. So we let these things go. We raise families, we take care of our home and hearth, and we just don't have time for us. And I kept thinking, when I got diagnosed, I thought that breast cancer was only for white women because that's all I saw on TV, when white women talking about breast cancer. Little did I know that years later, I was going to find out that African-American women are dying in bigger numbers of breast cancer, and Latinas are not too far behind. Having been diagnosed with breast cancer, I was pushing our family to get their mammogram. Little did I know that she was harboring something that was even worse, and that was, abnormal periods and just a fatigue. And unfortunately, when she went to get her screening, it was already too late. She died 9 months later. So in her honor, I wanted to make sure that no Latina was out there without at least the information of how to get those early detection screening. So I was the envoy to Mexico for the 1996 Olympic Games in Atlanta, and that's where we started. I was living in Atlanta, and I started the Health Fiesta model, and I approached the Mexican consulate, and I said, you throw such great festivals. Why don't we have one dedicated to Latina women where I can bring all the available clinical services for them and have some of my friends that we can train them to be helpful during that event. And we did. In the first year, we had about 285. By the fourth year, they were in the thousands. People were lining up all around the block. But when I started talking about this on the national circuit, more and more communities wanted us to go to their community, their city, to help them put together these health fiesta, and also to train people in their community to become promotores or community health workers. So in 1997, we started our first, and here we are, 25 years later.
First, I'm sorry to hear about your sister, but it's something beautiful that came out of that, because think how many other women's lives you've been able to save by getting them able to get screened, or even just having that conversation about cancer and cervical cancer, and then, continue to fight the good fight in regard of all the obstacles you've experienced and trying to help others with their healthcare journey. And for those who don't know what community health workers or promotoras are, can you kind of explain that so people have a better idea of what y'all do, who you are, where they can find them? What does that look like?
We just give you 4 words to think of how promotoras and community health workers work. It's under the MINE framework, MINE. They motivar. They motivate our community to get early detection screening. Informar, inform. They inform the community about available resources in their community. And for navigate, they navigate. They navigate people to get to these resources, to go through a complex healthcare system. And the last word is E, for educate. Educar. These are important features that we provide, and the community health worker does. These are people that are trusted members in the community that can be trained.
That's amazing. And if for folks, for me, I'm like, can I be a community health worker? Can I become a promotora? What does that look like? How can someone who's interested in doing the work in the community, how can we sign up for your course?
We're in the middle of our 28th generation. So we've trained, we've graduated 28 generations of community health workers and promotoras. We're going to start another one in September. We have scholarships available through a grant that we received from HRSA, 18 to 30. And those that are interested will be happy to bring you on board. You know, all you need is the heart to want to be a community health worker. There's no specific degrees. We have people who have cleaned homes for a living, and they turned out to be one of our top promotoras. And that's what we hope for. We have a lot of partners who are instructors, but we also have our team of 12 instructors throughout the state of Texas we are constantly teaching the course.
Awesome. And you mentioned 18 to 30. That's just for the scholarship, right? Like if you're over
just for
30.
The scholarship. Yeah,
okay.
If you're over 30, you could still come. We put you on a payment plan at $50 a month. But the main thing is that we want, if there's any kind of financial issues, we'll work with you. If we have to, find something for you to do temporarily where you can, get some funds to pay off the training, we will be happy to do that. But we've worked with so many people on their payment plan, but we don't want that to deter you. If your heart is set, usually there's times when at the end I go to my board and say, I need to sponsor one more person out of our budget. And we do that.
Yeah, I love the work that you're doing, because now health equity is a hot topic. Like everyone is throwing it around like it's a new buzzword. And meanwhile, back at the ranch, people like you have been doing the work, like really the work in the community. And so for you, what does health equity mean to you?
Well, you're absolutely right. There's a lot of emphasis on these days because it's a run for the money, going out for the funding. But in reality, in the perfect world, it would mean that everyone, regardless of color of skin, the language they speak, or the money that they have in their bank account, would have an opportunity for optimum health and wellness. And I say wellness because mental health is usually not even considered when we're talking about health. And we have issues with our community as well, because there's just very few mental health services that are available for those that don't speak English or that have limited English proficiency. So unless we remove some of those system and cultural barriers, it's going to be business as usual. And for many Latinos and Latinas in this country, the reality is this is what they live with day in and day out.
And I think that, look, not to get political, but with the Trump administration, that definitely highlighted how there has been a lot of negative sentiment towards the Latino community and not giving them the right services, or not also like acknowledging them as like amazing fabrics of part of the United States and the stuff that we have done in the world. And so I'm curious, like from your perspective, working in the Latino community, what are some things that we can do better?
Well, I think, for what we have found over the last 25 years is one of the biggest challenges that we have in our community is health literacy. And I don't think the government has paid, regardless of administration, has paid attention to the plight of our Black and Brown communities in terms of health literacy. We see, even with COVID, we put out millions of dollars to these agencies, and what happens is, a perfect example is if you don't have the material that's culturally and linguistically appropriate, it leads to more misinformation and misconception. So we had to go and interpret what was being written in our voices and with respect to their health literacy level.
Yeah, I think that's a really interesting point in regards to Spanish translations. A lot of times it's just kind of like Google Translate, and not all the times, like depending on what country you're from and like what Spanish speaking country you're from, words mean different things.
Yes, a lot of the informed consent for people who want to participate in a clinical trial, and even in some of the government websites, they have the word ensayos, which, for them, it's a proper word that's used in Spain for clinical trials. But here in this country, the word ensayos, if you're really looking at the cultural translation, ensayos means experiment. So how would you like to be invited to be a subject to an experiment? No, you want to be a participant to a clinical study. And just changing that to make it more culturally and linguistically appropriate for our community, you would have better results. Another thing that we've noticed in some of the informed consent forms is that the literacy level was at 12th grade and above. When you have a lot of information with a lot of acronyms, people don't just automatically know what FDA is or CDC or NIH. And we seem to throw those out as if we expect people to know what they were.
What other things are happening? I know there's immigration conversations too. Like if you're undocumented going into the healthcare system, you may be afraid to provide your information because you don't want ICE to come get you, which is disturbing in itself. But like these are factors that are people thinking about when they're getting their vaccine or getting tested with COVID or what. Can you talk about that in more detail?
Absolutely, Ashley. I think, to sum it up, I always said misinformation plus miscommunication plus misconception leads to or equals to mistrust. I was one of those that in the beginning, when I heard vaccine hesitancy, I kept saying, no, it's access. They want to get the vaccine, it's access. But now, coming full circle, we're back to hesitancy. And it's because of the dramatic effect of misinformation and the miscommunication and the increased mistrust that we have now in our community of any kind of government-sponsored program. We suffered ourselves with a government-sponsored program, and as a funding mechanism, and these are the kinds of things that kind of hurts because the government is trying to build trust.
Yeah.
But they're not doing it in an effective manner. It is like a good idea, but it's poorly executed.
Yeah, and you're saying that so nicely. For those who don't know, Venus was recently featured in a CNN article talking about NIH's efforts to get more folks vaccinated in the communities. And as you all know, Black and Brown communities, Black, Latino, Native American communities were disproportionately impacted by COVID. But with that said, the article, which we'll definitely make sure we include the link below, NIH has a Community Engagement Alliance Against COVID-19 Disparities initiative, also called SEAL. And Venus was she was one of the many grassroots organizations that were like raising their hand saying, yes, we will definitely help you. There's so much work that needs to be done. And you kind of got the shaft, like you guys didn't get paid. Let's talk about that? Because I want people to really understand what's really happening in the space right now as we speak.
Okay. As a cancer survivor, I've had to learn early on how to choose my battles. But this one was one that I decided to really call attention to because it not only affected us. We have Native American groups in that I've worked with and that were part of the SEAL program that I heard from about the fact that they weren't being paid as well. And it just got to a point where I started having these discussions and realized there's a problem here. But what happened is that all these millions went out to these academic institutions, and these institutions create metrics that inherently are biased when allocating budget funding to community partners. They expect us to be on the same equal pay, not equal pay, but even field with a university. So when they tell us we have to have all of these items in place, we have to do this, we have to do that. It's hard for grassroots organization to pull all that together, but we did. And we started to send our invoices of our work. And so for 4 months, until I finally got to a point where I got the information that what I needed to get the PO, my first invoice was in March, April, May, June. June 11th was when I got the PO number and to go ahead and then submit an invoice. And, again, it took 6 weeks then for them after that to get paid. And we're a small organization, so we had 2 employees. And so we had to use our emergency funds to pay just because we're respectful of our people in our community.
Yeah. First of all, I don't know anyone, like just a regular person, no one could wait 5 months to get paid, let alone an organization that owes tons of people on their payroll because they're doing this amazing program to really address a major global pandemic at the root cause, like with the folks who are on the ground. What if you did not have, because I know there's some organizations that are literally working like on a shoestring budget, like rubbing 2 pennies together every month. What if you didn't have that emergency fund?
Our commitment to our community is a priority. So we make it happen. I do a lot of presentations, and all that money goes into what we call our emergency fund in case we need it. We do a lot of translation for a lot of big corporations and a lot of pharma corporations to make sure that the language that they're using for our community is culturally and linguistically appropriate. And so those funds go again into our emergency funds. And that's what got us through this. I also have an incredible, how should I say, I have been blessed with so many organizations. Nashua is one of them, just so many organizations. Vaccinate Your Family is another. These organizations came forward and helped us financially until we got on our feet again, and we're able to, but guess what? We continued the program. And that's what the government doesn't realize. We were so committed to this, and we just couldn't stop it just because of the funds. So we continued the program, and it was, you know, it was hard in the beginning, but you know, it's like the loaves and fishes, you know, God provided for us, and we were able to continue to pay folks. We continue to get donations from people in the community, and our priority is our community, and we continue to do what we can. We are still believing in the federal government system's way of funding, but we got hit again, Ashley. We had there was a what we call a request for proposal with a major government agency. And we had a 96 score. We had no weaknesses noted on the review. We didn't get the funding. And when I asked what happened here, I got your standard, this is what it is, you know, that hurts us, that we've been around for so long. And we've been trying to work with our community and really bringing out the best of the promotoras and community health workers with this great training program that is certified by the state. It's very concrete. It's very, but it's a way of us integrating community health workers and promotoras in health and wellness, and how important that is. And when we see somebody who gets $6 million and their biggest fundraiser is cigars, whiskey, and wine, I mean, you know, we're thinking, okay, that's great. But
they're not doing the healthcare work. Stop it. Just stop. Like that. Stop.
but that's just it. What happens is that the government uses these metrics and they're just checking off boxes. They're not looking way deep dive into these organizations and to see, are they really working with the community, or is this just, you know, what we call beltway bandits, people who just run for the money when there's an RFP or a proposal coming out. And then those of us that are small organization, faith-based and community-based organization, we're seen as an afterthought. And then the sad thing is that when some of these agencies get the money, then they come to us to do the work. We're the foot soldiers. We're the ones that are out here combating COVID, and we get, you know, 10,000 here, you know, and I'm talking about some of these agencies that have come to us and tell us, do you think that your community health workers can, you know, get $30 of a gift card if they do all this, you know, for 1 hour? And I'm thinking, no.
So what can we do as a society to try to get this right?
I think the government needs to listen to community-based and grassroots organization a little bit better than what they're doing, and take us seriously. We want to roll up our sleeves and sit down with you and create some of these strategies. And we want to do that. We want to continue to do that. I applaud the White House, though, for engaging the National Association of Community Health Workers, Denise Smith, and bringing them together, because we are one of their partners. And she called on us, and we were able to speak to a White House person, to a White House representative, to share what some of the issues were in our community, even with the rollout of the COVID test kits. We found a lot of issues from the beginning, and they heard us, and they immediately addressed it, which I thought if they had done that before, we would have seen this type of thing much better. We would have been able to handle this much better.
We're mentioning the White House and how they're trying to right their wrongs. Like, I think, you know, at the beginning, everybody was scrambling, just trying to get it right, and dropped the ball in a lot of ways, especially when we're addressing with COVID. Hopefully moving forward, they realize the value of community health workers and promotoras and other community-based organizations, because you live and breathe the work on the ground. Like, you know what's happening in the communities, you know what people's concerns are, you know some of the barriers that they may be experiencing.
I think the government really needs to look at the metric system that they're using, and they need to bring it to the table. We'll be happy to share what would work.
Hopefully the White House continues to use your voice and invite you to the table. But for the other ivory towers that are in the world, in the US, how can they invite folks like you to the table?
If there's a commitment to find out where they can find reputable and transparent organizations that are community-based and that are really committed to community long-term, we're out there, commitment versus convenience. No more checking the box. Nomas no more.
Yeah, and so let's talk about Nomas No More, because I know this is an initiative that you're starting, and I would love for folks to know more about what Nomas No More is. Like, you're doing some amazing work and like on behind the scenes, and like, let's talk about it.
Well, the Nomas No More campaign started with our way of just debunking misinformation, being a place where, no more lies, no more conspiracy theories. These lies divide us as a nation. So we need to stay on top of it. We need to get information that's evidence-based. So it really started with that. But then when we started realizing that these hyper disparities, these issues that continuously, time and time again, are showing up, we felt like, okay, there is something else here. We need to, these things, we need to start looking at these deep-rooted underinvestment and undervaluing of our faith-based and community-based organizations, of our community health workers and promotoras. So Nomas No More is now looking at these hyper disparities and saying, no more. The government needs to start looking at these funding mechanisms that are really causing a drift with our community partners and our faith-based community health-based ministries, and we need to be at the table when they're developing all of these plans to reach us. We need to let them know this is not going to work, or this infographic is not going to work, or this particular wording is not going to work. We need to be there at the table instead of being seen as an afterthought.
You literally like crawled and walked so we can run behind you, which, I mean, that says everything, right? As you as a person, but just also as another person of color, I admire that. What lessons learned would you share with your younger self, or folks like me and younger, who are trying to do the same thing you're doing and experiencing probably some of the similar barriers? Because, I mean, racism still exists, and we know the government isn't perfect. So what advice would you give us?
I think it's connecting the dots is one thing that I have learned to do early on, is having these interpersonal relationships with people. But I think one of the things that I've learned over the years, besides that developing of that interpersonal relationship, is creating your circle. I think with me, it has helped to have people who really care about our community, not the naysayers. If I have any naysayers, I don't need those in my circle. I need to have people who care about our community, who want to roll up the sleeves and start working on whatever issues are we need to address, and coming with their heart, because that is what we're going to work with, is your heart in developing that kind of communication with the heart, the interpersonal relationship with the heart, the advocacy with the heart, is all really coming together for the good of our people. And we can do that as a community. We've moved away from it. But many years ago, our promotoras were people that in our community, in our little block, or in our small neighborhoods, that we always knew one person who could read the letters in English, and everybody went to that one person with their letters just to say, what are they trying to tell us here? Or one person who knew how to call and make an appointment for you. So we've had these wonderful people in our communities who have always been in touch with our communities. Get together with those kinds of people, and not those that are just running to get grants. Going back to my younger self, I would say I wish I would have earlier on pulled some people together that had the same idea that I had, that we need to do something for our community, and not wait. I was in my 40s when I started Dia de la Mujer Latina.
I'm just like, we're over Zoom. I just want to give you like one of these. Like, I think that was beautiful. Yeah. And I love that your heart has carried you the whole way. And as you said, you started in your 40s with this organization, but better late than never. And just think about, and I don't know if you've sat and really reflected on how many lives you probably have saved just from the work that you're doing that just comes naturally to you, but it's a lot of work, and you're providing access to a lot of women and people that they probably didn't realize that they had, or didn't feel like they could advocate for themselves in spaces. And so on behalf of everyone, and especially those who are in Texas like me, thank you, because you're doing like God's work, but you're also doing like the work you're called to do. And unfortunately, like you had to experience cancer and lose your sister because of it, but you've turned it around to something that's so, you're saving lives, like you're saving lives. And I just think that's awesome. That's just awesome. So you're doing all this amazing work. And if people want to donate to Dia de la Mujer Latina, what's the best way to reach you, to send funds or send goods if there's a hurricane coming, or again with COVID too, like what else, what can they do?
Well, thank you, first of all, for anyone who wants any bit of money would help. I mean, that's, to me, we multiply whatever we get, it's just multiplied in our bank. But one of the things that I would say is if they go to our website, we have a donate button. So that's an opportunity. If they shop at Amazon, we also have a button as well. Again, any bit of money helps. Sometimes we use some of that money to sponsor some students to go through our training. And the beauty of this too is the fact that when we had, right after COVID, we had trained so many community health workers on our newly developed contact tracing training that we turned that over to CDC, and we were able to provide with the city of Houston and Harris County 273 resumes of our community health workers, and they were all hired. So to me, that I can't put that on a survey or rating or anything to show that we did this and this is what happened. But for me, it's a satisfaction that I am planting seeds, and they've been very fruitful. And many of them are people that I can call now and say, I have a patient, or I have a customer, I have a person that is going through the situation, because they're already embedded in many of our organizations and our partner organizations. So that's beautiful.
Venus, I just appreciate you for coming on this show. This is such a candid and lovely and kind and educational, all the things, conversation. Like, this is really great. And I hope more people can support you and your amazing organization. And of course, donate. Go to www.diadelamujerlatina.org. Thank you so much, Venus. I really appreciate it.
Thank you.
Bye. Ciao.